everyone. We are Evergreen Project. I'm Rachel. Today, I would like to give a presentation with my teammates, Jennifer and Maoli. So let's start the first part, problem identification. Our idea was inspired by the being a sick old man living in subdivided flats and with limited mobility, and he can't now to go to the client to take his medicine. Based on the problem we found we will try to give solutions as following. Our first solution is to build up an e-commerce platform which includes 5 major functions, including the dispensary and delivery, home medical service, and calling ambulance. Their personal data like address will be collected by e-health system in advance. Apart from that, our second solution is food delivery platform such as Foodpanda, Uber Eats, and Deliveroo, which deliver medicines plus healthy products. We also want to work with the school service learning or NGOs such as PolyU and crime preventions. And so in this situation, what do we gain? We will get the free labor because compared with the food delivery platform, service learning organized by our school is public welfare projects, and NGOs are also public welfare activities. And besides, what will our partner gain? The students can gain improvement through public welfare activities, and they are learn how to give back to the society. Also, schools who cooperating with us can get a good reputation. In order to better understand the needs of target consumer and their current situation, we conducted a marketing research. We interviewed a total of 30 respondents and asked the following questions. Based on the marketing research on the previous pages that the elderly have a great medicines and cold medicines. So this is the end of my part. I will pass time to my group mates. Thank you.
Thank you. We believe for the first year, we're already able to generate near 40,000 of profit per month. And when we're heading towards the 5th year, we'll be generating near 2,100 profit due to our expansion to supermarkets and globally. Our expenses include website maintenance, delivery costs, and wages for employing different people and marketing. Moreover, what will be our impacts? Our first impact is elderly on the poverty line can enjoy medical service with a way lower price. Secondly, it is more easy, simple way to get medicines and to maintain their health, and they receive correct health information. Fourthly, we are social inclusive because we provide job opportunities to all rehabilitation people, intelligent disabilities to deliver medicine and back office work.
Okay, thanks, Jennifer. And I'm Miley. I'm going to talk about why our ideas is good to use in the community. So consider the feasibilities of our team and also the impacts to the users in the market. First of all, I think it's most important. We need to do the promotions to shape the cultures of serving the elderly. And the second point is about ask for experts like professionals, even the professors of our ideas. And the most efficient method is to adopt the ideas into the service learning program by universities. And as our PolyU, we have service learning program, and that's why I think it's the most efficient method to adopt the ideas. And okay, so after we use the ideas and adopt in the society, we can try to collaborate with NGOs and then the elderly, the elderly service center, and then later we can try to develop the ideas, develop the apps and put in the community and society. Okay, so what we just mentioned, you can see the ideas is that if it's good for us to adopt the ideas, if it's successfully to adopt the ideas, and it can these ideas can be adopted for many years. Okay, so here comes to another question is that for the questions, the first one is funding, because the app development, of course, and the promotions, so we need the funding. And the second point is if we work with partners like NGO and also the GCDISI, we need to think and consider what's the opportunities they provide for us to adopt our ideas. Okay, and then the third idea is we need to consider how the universities can help us to improve our ideas and then to implement the projects into the markets. And last but not least, is the most important way is about the using usage rates of the mobile phones about elderly. So right-hand comment is about the news from South China Morning Post. And then you can see even under the COVID, there are many elderlies, they try to use the smartphone, but there are still 1 in 4 elderly still without devices. So here comes to another question is that when we need to adopt the ideas, we need to think about the usage rates. Okay, and then last point is about our prototype. So you guys can scan the QR code and also yeah, and I'll provide the link on the chat box. You guys can click it to see. Can you see the link?
Yes, we can see the link. Thank you very much for our presentation, and thank you very much for listening. Please feel free to ask any questions.
Thank you, team. Judges, please go ahead if you have any questions you would like to ask the team.
Hi, can you hear me?
Yeah.
Yes.
Yeah, I love the ideas because during the pandemic, there was so many, voluntary program to support those other people in the communities. When especially, when the communities, lock down the period. So my question is about when you say you include those volunteers and NGOs as free labels or something. So how can you do the quality control?
Yes, thank you very much for wonderful questions. Firstly, we are going to collaborate with a few NGOs that is majoring and focusing in helping elderly medical service. And we actually listed some in the PowerPoint. In fact, there are lots of registered doctors and nurses to help them to control. Secondly, we can actually using the e-health system provided by the government, and it actually records all the past medical records of the elderly. So you can make sure to know that what are the drugs they're using, and are there any allergies and stuff. We believe that this can help us to do quality control. More importantly, we have actually added a medical record for them in order to help them check and remind them how to use the medicine. This is how we're going to do our medical control and quality control. Also,
Okay,
here's breaking.
Thank you.
Thank you. I think Mr. Alberto has also a question.
Yeah, hi. My question is similar to the one I asked to the first group. How do you know that the elderly will be able to use the application that you created? Like I said earlier, I live with elderly myself, and the challenge is if they want food to be delivered, you're the one who asks, you're the one who does the app, and you're the one who has the food delivered. It's not really the elderly. So how do you make sure that it's elderly friendly, for example?
Thank you for yeah, Jennifer.
Yes, thank you for your questions. Firstly, we have used the most simple buttons here and with very, very large words because we believe simplicity is the most easy stuff. Thirdly, because we are using the e-health system provided by the government, so which means they do not have to input so much information which they don't know. When we're asking them to input in the address, phone numbers, or any other stuff, it's very complicated, right? But we don't have to because we connect to the e-health system. So what they need to do is just to click a few bits, and then the nurses, the doctor will automatically give you the list and how to handle the medicines for you and deliver to your house. And that's pretty easy and simple for them. Just a few steps.
Sorry, last question. I also noticed this is a pattern of behavior, no? And I don't know if it's a Filipino thing or an elderly thing, but usually when they feel something physical, they don't want to go to the doctor. So even just asking them about symptoms and how they feel tends to be a tricky issue. So ideally, I love the idea, and honestly, I would implement it if I could. But it's a question of whether the elderly that you are targeting will be honest enough to admit, I feel this way and therefore I should consult a doctor or something like that. Do you have any means of addressing that?
Yes, firstly, we're tackling those who have long-term disease, including those who have diabetes, high blood pressure, and actually they're very cautious of their health. In fact, because they have to check, they will went to the hospital to check every day if they need. And they're also always feeling uncomfortable. So they're actually very willing to tell the doctors about their syndromes. So that's why we believe that perhaps due to pandemic, also the medical system is really collapsing and it is not easy for them to book doctors anymore. And even if they want to find someone to talk to, it is really uneasy for them. And how about, and no, not and then not talking about getting medicines. They don't want to go out too. So that's why we're having this kind of service. And we have virtual meetings. They just need to click a few bits and then can talk to doctors directly.
Thank you so much.
Yes,
provide, like we are not just sending the medical products to the elderly. Okay, we've just mentioned like we will like sending delivers the products, like even the health products, okay, like vitamins and other stuff. And if you know under the COVID there are Chinese medicines like 莲花清瘟. I don't know what's the English name, but just know you know the Chinese medicines to deal with COVID. And then okay, so considers the elderly situations. I think if we put these ideas okay later and more products, we can just help to deliver and to facilitate the process. So this is the ideas and the purpose why we try to use this into our presentation and projects.
Thank you. We have time for one more question. I think Ms. McCain also raised her hand. Please go ahead.
Thanks so much, and thank you for your presentation. I really enjoyed that you gave deep thought to potential challenges and limitations to implementation. I saw on your PowerPoint about finances, it seems that you anticipate to make a profit. What do you plan or hope to do with this profit?
Actually, our profit will not be only using to support our business. Because what are we going to do after gaining our profits? We're going to do more social inclusive activities. As we just mentioned, currently we are recruiting rehabilitation people, which means they just released from the jail and maybe they have committed crime before, or maybe they have had intellectual problems. But however, later we'll definitely be involving more, such as we'll be involving more those who are handicrafted, and we are gonna give more job opportunity to those who are living in poverty. Because under COVID situation, there's many people who are they're being fired, they're not employed. However, they also need to take care of their family. It's very uneasy for them. And our job is to donate some of the money to them and try to train those people who are lower educated and who need more skills. This is what we are gonna do. And even if they leave our company, we hope that by using the skills that we have taught them, we have told them what to do, they can actually find a new job and to create a better future.
Great, thank you so much.
Thank you very much, Hong Kong team. So time's up.